My name is Latia. I will be 39 at the end of March, and I am a stage 4 endometriosis patient that was diagnosed February of 2017 after 23 years of symptoms. Yes, so it took a long time, and I honestly believe that if I didn't have the lung collapses, I probably still would be dealing with endometriosis. So I woke up one day, felt a little chest tightness. Something told me to go to the urgent care center. She thought I had some bronchospasms, gave me a couple meds, didn't work. And then I told her I felt something was like sitting on my chest. So she sent me to a radiology center to get a CAT scan to rule out a pulmonary embolism. And it actually was a right lung collapse with pneumonia. So off to the ER I went, had to have a chest tube placed in. I was on the second day of my period, and I really didn't tell anyone. I didn't think anything of it. And it's quite interesting that the attending did say you don't fit the typical description of someone with a spontaneous pneumothorax, but she didn't dig a little deeper into it. I also have blebs on my lungs, which are little air pocket cysts. So they said I had a spontaneous pneumothorax due to a rupture of a cyst. So I ended up staying in the hospital for 9 days, had to have a surgery, a lung resection, and a pleurodesis, which is just a little procedure so that your your lung wall adheres to the chest wall cavity, preventing further collapses. So I was told I would have a 10% chance of my lung collapsing again. So since then I still had a lot of difficulty breathing and chest pains and lots of testing, and was diagnosed with asthma, which I didn't believe. And then about 2 years later, again, I woke up. My lung collapse has happened during sleep. So I wake up. So I woke up and I knew that feeling. Went to the ER again. Chest x-ray was normal, but they had me do another chest scan to rule out another PE, which showed another right collapsed lung. So after I had the second one that occurred on my second day of my menstrual cycle, I knew it wasn't a coincidence. So I started, actually in the ER, I started Googling just like lung collapses with your period. And I saw catamenial pneumothorax. And right then, I found a really good pulmonologist in New York City. Started learning, just Googling different things about it, information. I remember printing some articles from Dr. David Redwine. And I went to my pulmonologist and I said, here's information. I think I have catamenial pneumothorax. And he kind of looked at me like I had 10 heads initially. But he actually was the first person to mention endometriosis to me and told me to find a specialist so that they could communicate. So I found a doctor in the city, and I already, my gut knew that I had endometriosis, and I had diaphragmatic endo, and I had catamenial pneumothorax, and I just said, I just need you to help me. And he believed in me. He believes me, so I had a surgery. 7-hour surgery with 5 specialists. So in addition to a thoracic surgeon being there, I had a urologist, a colorectal surgeon because I needed a bowel resection, and so a thoracic surgeon, endo specialist. A lot of people came, obviously. And I was doing great. I was doing fine until I had my menstrual cycle again and started experiencing this debilitating sciatica pain, severe rectal pain to the point where I was bedridden. So I went back to my surgeon, who found a nodule, and I had to have a second surgery, 11 weeks from surgery 1. Yes, and the nodule was pressing against my sciatic nerve, which is why I was having all these symptoms. And I was living my life, doing okay, and then 7 months later, the pain started coming back again, of the sciatica pain. And I pushed it off for a really long time, like how Melissa was saying, you're in denial. You don't, you're trying to live your life, you're trying to be positive. And it was actually another endo sister that said, you need to go see your doctor again. And I saw him again, and indeed I had another nodule in that same area, and I had to schedule another surgery. So that's 3 excision surgeries in 22 months. That's 2 surgeries on my lung. That's 19 hours of surgery when I calculate everything. Between my first collapse and my second collapse was about 2 years. So I had 4 collapses in total. I even collapsed waiting for my first surgery. And that I was diagnosed with endo of the ischial spine for that 3rd surgery. So those symptoms were severe rectal pain all the time. It wasn't just during my cycle. Buttocks pain, pain down my thigh. And I'm doing well now. I'm just very, very grateful for just having surgeons who really believe in us and who really take the time to listen to us. And I just have to say to each and every endometriosis patient here that we really have to educate ourselves so that we can advocate for ourselves. Because there are going to be doctors who are going to dismiss us. We just have to keep fighting. We have to keep pushing and find a doctor who is going to believe in you and is willing to help you. Thank you.
My name is Anna. I'm 34 years old. I had painful periods from the start. I always suspected I had endometriosis. My mom had severe endometriosis. I watched her suffer for a long time. It wasn't until I was 21 that I had my first surgery. It was through ablation. I just remember one time just being on the grass after school and just being huddled in pain, and I couldn't even make it to the front door, and I was waiting for my parents to get home just so they could even bring me inside. After that first surgery, I felt a little bit of relief. I was on off birth control pills for a while. I was on Depo-Provera, which kind of helped my symptoms. I'll be honest, the withdrawal symptoms were pretty severe for me with Depo-Provera. My next surgery after that was when I was 27. Again, that was through ablation surgery. And I thought, based on the knowledge that I had, that I felt like I was fixed and I was doing everything I had to do. I was on birth control. I was getting these surgeries. I thought I was staying on top of it. I had gotten married, and at that point, we had tried to get pregnant. After some failed IUIs, a couple failed IVFs, failed IUIs with injectables, that still didn't work. And then having the pain come back and a new symptom of having blood in my bowels when I was going to the bathroom. That took me a while to put 2 and 2 together to figure out that it was during my period. It was actually a fertility doctor, and I had a very honest conversation, and that's how I ended up seeing the endo specialist, the endosurgeon. I had surgery September of last year. What I thought that was under control was 41 positive endo lesions removed, splattered everywhere. Sigmoid colon, cul-de-sac, bladder, ovaries, fallopian tubes. It was just everywhere. It was a tough recovery. About a few months later, I definitely started to feel a little bit better, and I was starting to do the fertility treatments again, which is when I ended up in the ER. Throughout this whole time, I was having all this pain underneath like my right rib cage, and I got, at the time, acupuncture definitely does help even for me now, but I was getting acupuncture and muscle massages, and I thought maybe it was the way I was holding my bag on my shoulder or just being in front of a desk and typing every day, and that's all I really chalked it up to. I really didn't understand truly what endometriosis was and how could it definitely impact organs outside of the pelvic region. During that surgery in September, the endo surgeon did see that I had diaphragmatic endometriosis. It was about several spots within the dome area. So when I was about to start fertility treatments again, I ended up in the ER, severe amount of pain, shortness of breath, and I decided to then do, 5 months after my first surgery, my third, but first excision surgery, I decided to go back and to take care of the diaphragmatic endometriosis. That was a month ago, this past Friday. During that surgery, the surgeons kept searching for the endometriosis, and they did find when the liver was pushed down that there was significant disease by the diaphragm, between the diaphragm and the liver, that wouldn't have been seen if they weren't really endo surgeons who were as knowledgeable and specialized as they were. So now I'm recovering, still trying to kind of, I'm definitely still doing acupuncture. Ever since the first surgery, I found kind of, the organization even, and in terms of endo sisters that are out there who have gone through such similar things, who have really helped a lot with anxiety and even panic attacks, and just being able to just understand and just think through everything that's happened in such a, even for me, knowing that I had endometriosis for so long, or suspected that I had it for such a long time, and I've had, some of those surgeries at a younger age, I just didn't really understand it. I didn't understand the impacts it could have to someone's life. I didn't really understand the impact it can have physically, emotionally, mentally, and didn't really understand that it can go in other places. I mean, during that time, I had 4 tests on my gallbladder, because I was convinced, doctors were convinced it was gallbladders and MRIs, and but really wasn't until that excision surgery 5 months ago where a lot of things just started to make sense. So that's my story. Thank you.
Hi, my name is Zara, and I am 47 years old. And I also had a lung collapse. So this happened about 4 years ago. I was sitting on a couch, not doing anything, and I had a shift happen in my chest. And not knowing what it was, I thought I was getting sick because I hadn't felt anything like that before. So I went to my general practitioner a couple days later, and he told me, listening to my lungs, that he thought I had bronchitis and to take an inhaler. So I went home, took the inhaler, and started to see that nothing was getting better. So a few days after that, I went back. And then he said to me, well, at this point, you probably just need to take some cough medicine because you're coughing, and let's see how this works. And then, if it doesn't get any better, we'll take you to get an x-ray. So I'd say a couple days after that, this is going on 2 weeks, it got to the point where I couldn't even walk. It was so painful to walk, and I had never experienced anything like that. So I called him and I said, I need to go and get an x-ray. And so he put the prescription in, and I'll never forget, I'm sitting in my office, and all of a sudden I get this call that, go directly to the ER. You have an 80% lung collapse, and this is very dangerous, and go to the ER. And I was like, okay, well, what is it that I have? And he says, you have a spontaneous pneumothorax. Like, okay, I don't even know what that is. And so I went to the ER, and I decided at that point that, it's actually a pretty involved story, but when I came to the ER, they were actually kind of excited that I was there. There were residents, and they were looking forward to poke my chest, and I didn't feel comfortable with these guys, so I actually wanted to leave and go into be around doctors that were a little bit more, had more experience with this. So I ended up leaving, and then I was told if I have a fever that I should go back to a hospital. So I ended up getting a fever. I went to the hospital. And so I was told that I was a spontaneous pneumothorax, tall, and I fit the bill. So everyone's kind of put me in that bucket. You have spontaneous pneumothorax. And with that, you've got a 50% chance of having another lung collapse. So I always knew that in the back of my head, okay, so this could happen again. So at that time, and the first time I had it, they just put in what they call a pigtail, and they drain the air out, and so that your lung comes back, all the air drains out, that your lung re-expands again. So then I left, and I'd say about a year later, just living my life, and then I felt that familiar shift happen again. And at that point, I knew, okay, this is what it is. I know what it is, and so I need to go to the ER. And so I went to the ER, and that was a point I discussed with the surgeon, that I should get the pleurodesis, which is the reattachment of the lung to the chest wall. So I as well had blebs, and they cut out the blebs, and they scraped the lung, and they literally, like what they say is they staple your lung to the wall chest. And then from that point, I was told that my lung should be stable and should never collapse again. So after that, it was the most barbaric surgery I've ever had in my life, could even ever wish on anybody. It's horrifying. It's so painful, and I had so many different every month I felt, and I'd say there was something twice a month. I didn't feel right, and I felt like something was happening with my chest. I walked around with an oxygen meter, so afraid that I was going to die, panic attacks, like everything that you could ask for. I couldn't focus, and I just wanted answers. Why me? Why is this happening now? So I kept going to the ER, to the urgent care, to my doctor, and to the to the thoracic surgeon, and I felt like I was going crazy, like, because they kept on saying, but it's fine, like your lung is attached, don't worry about it. But I said, that doesn't feel right, there's something not there. And that one of the after seeing the surgeon like 5-6 times, I sat with him and I said, listen, I'm 44 or 5 at this point. What's going on in my life that could cause this? Am I like perimenopausal? Is it hormone related? I went through mass rounds of IVF. I took massive amounts of hormones. I mean, could it be hormone related? And he looked at me and he's like, well, there is this thing called catamenial pneumothorax, but it's extremely rare. Well, I'm like, well, what does that mean? He's like, well, it usually happens on the right side. I'm like, well, it's on my right side. He's like, well, you have shoulder pain. I'm like, yeah, I have shoulder pain. And then he's like, and it happens around your period. And then I started to think, well, I'm like, well, every time I think that I'm in pain, it's ovulation and period. So I went home and I started to Google catamenial pneumothorax, which is like 0 out at the time, like nothing, which is even more maddening because you can't understand how to try to find something that there could be, but you don't know if it is because there's nothing out there. But what we decided to do was to go on the pill at that time to suppress my periods to see if that helped. So 3 months on the pill, I had another collapse. It was a partial collapse at the time. I went to the doctor, and we decided to just let's ride it out and see what happens. Well, that turned into a full-on collapse that I ended up back into the ER to the point where the doctor's face was white because he had never think that a lung could not stay attached after the surgery. And so at that point, it was determined that actually, I should have mentioned, he brought in endometriosis to that conversation above, and I didn't know I had endometriosis. I didn't really know what it was to have endometriosis. I had heard about it, but I didn't know much more than that. So point being that when we had that second or third collapse at the ER, we had an endo specialist come in, and it was determined that I did have endometriosis, stage 4 endometriosis. It had gone all the way up through my ovaries and diaphragm and up my diaphragm. And so thankfully that was what it was at some point even determined, and there's nothing, I think, when you start to feel crazy, you just wanted answers, and at least there was an answer for something. And so the first part was to remove whatever we could because the endo surgeon that was there wasn't there for the surgery. He was there just to verify. So he took out as many lesions as he could, and then they reattached my lung again. And so from there, we thought that what's the best thing for me with my age? I had, thankfully, all the rounds of IVF, which I still think, my opinion, is a big culprit for what happened. And I don't understand when I went to all my IVFs and no one ever asks you, do you have endometriosis? Because if you can, this could mean that you don't need to go over the IVF, but that's a whole nother story. I decided to have a hysterectomy. So I had my uterus and both my ovaries removed. And so that's been about over a year now. And so since then, I had waited 6 months, and now I'm on hormone replacement therapy. And it's a very low dose. I take it twice a day to have a very even-keeled hormone. But you know what? I still, every day, I have panic attacks about it. I still don't feel like I'm trying to trust my body. There's something about my body where I want trust. It's been a really hard journey of trying to get pregnant with IVF first and foremost, and not having faith in your body, and then going through something like this and feeling that, how safe are you in your own body? And I've said this before, that and especially something to do with the chest like this, when your knee hurts or your leg hurts or your toe hurts, you know that what it is. But when it's in your chest, I mean, if I could, I would get an x-ray machine to get daily x-rays, because it's such a frightening experience. And who would have thought it's all because of your hormones, how strong your hormones is as a woman, that could literally pull your chest, your lungs down. It's fascinating and crazy, and it's amazing. It's literally amazing. And one more thing I like to say is that I do think that there's a lot more women out here that don't know this. They don't know what's happening to them. There was an article that went around with the New York Times. It was written, it was about my story. And the doctor then that received letters, she came back to me, and some of them that I saw, I corresponded with one woman. She lived in my building on my floor and had catamenial pneumothorax and had a hysterectomy. I mean, if you're going to tell me it's rare, and then meeting people like this, I don't think it is. Thank you.
Thank you all for sharing your stories. I was very moved by it. I'm a physical therapist, and I work with patients that have this. And how do you deal with like your lack of, being out of work? Because what I'm hearing from people, like they're missing work and, they're being driven to go back, and they're saying it's not disability. It can't be a disability.
I had 2-year-old twins at the time this was all happening, and I had a full-time job. So I actually had only a couple of weeks off in terms of the hospital, but I had to live my life. I couldn't. Thank God I had a husband who was able to take on a lot of it, but I had to go to work and I had to take care of the kids. So I wasn't able to do that.
For me, between surgery 1 and 2, because they were only 11 weeks apart, I was actually out on disability for 6 months. That's really how long it took, because I had quite a couple of complications afterwards, a lot of pain. So really it took 6 months for me to feel somewhat ready to go back to work, because my commute was 2 hours each way. And I was on my feet the whole day. So thankful that I had disability insurance, short-term disability. It wasn't 100% of my salary, but it definitely helped.
I'm in finance. For me, it's pretty hard to take time off. I had the surgery in September. I went back after probably a few weeks, which was probably too soon. Probably did it again to myself this past time. I'm thankful because they're just very considerate of the fact, or I'm able to kind of share my story with them or some of like the senior people that are on the leadership team. But it's hard. It's commuting both ways too, and but it's making your health a priority and yourself a priority that you really have to think about.
Thank you.
Thank you. Can you talk a little bit more about the financial aspects of how you actually covered your endometriosis treatment? Because I tend to find that a lot of doctors that do specialize in endometriosis, that they don't necessarily take insurance.
For me, my incision specialist also did not take insurance, but I have out-of-network benefits, and I'm a case manager, so there are ways that you could apply for a doctor that's out of network to be in network, and you could just give a lot of medical necessity, give clinical, because I was just very complex. And I took the time to actually talk to my case manager and just tell her my story and tell her how, due to endo, I was having these lung collapses, and she said she had never heard of that. She only thought that it was only in the pelvic area. And I was very fortunate that my insurance company approved my surgeon. So all of my surgeries were covered by my insurance. Because it is a very big financial burden, and a reason why a lot of women unfortunately cannot have excision surgery because of the cost. So I'm just very grateful and thankful for that.
Yeah, I also went to somebody who didn't accept insurance, but was lucky that I had the insurance that was for the out-of-network, the deductible was feasible.
Hi. I've been in events in England, in France, at the summit last Sunday, these 3 days here, and I'm still a bit shocked and surprised how we seem to talk about and present endometriosis still as a pelvic condition, and talk about it when it's evident that so many cases exist that are extrapelvic. So it's that whole argument of extrapelvic isn't rare, but finding someone who is adept and capable of treating it is rare, and that's not the same thing. So someone who's very forward-focused and positive, and how are we going to get forward from here? How do we get forward from here? How do we globally agree to change the conversation and to change the dialogue and to change the information we're putting out there to say, this is a body-wide systemic condition, which we've been discussing these last 3 days as well. Just putting it out there for discussion. Anybody?
I think that's a great point. It really comes back to education. I mean, you see with Tia and Zara's both, it's the understanding of the doctors and the specialists that you're going to be able to connect the dots and put those two together. And sometimes with the endometriosis in the diaphragmatic or lung area doesn't result in a lung collapse, but intense pain in your shoulder blade, pain down your arm, pain, in the rib cage, right? So it's understanding what that is, and it's really just about education and knowledge.
and also in every department.
In every area.
Because we
Yep.
present with different parts of our body, and the medical system in every country
Definitely.
dissects us into different departments. So we need all of those different departments to be educated about endo,
Completely correct.
please.
My lung did not collapse. My lung could not. I just had severe pain at the time, just severe shortness of breath. Like I really couldn't make it between the bedroom and the kitchen without just being significantly out of breath. But it was not a lung collapse.
All right, thank you, Latia, Anna, Zara. Thank you so much for sharing your experience. We got it.